What's an overhyped ingredient that you see people gravitating towards?
I like hyaluronic acid, but I do think that it's just in everything. And there's a lot of people that feel like they need a dedicated serum. I'm more concerned with someone getting that sunscreen on their face.
So many people will be like, I'm getting married next week. What can I do? And I'm like, absolutely nothing. Give me your take on Gua Sha. Should people be doing it at home?
I have different Gua Sha style tools that I'll use sometimes in facials.
Can you help shape someone's face with lymphatic massage, this tension that we put in?
I think if someone drank a lot, had a lot of salt, they're holding a lot of lymph fluid in their face, you can see it pretty much instantly after you start working on it for a few minutes.
What do you think of Kim K's new liposuction garment for your face?
I mean, it's compression, obviously. It's had surgery. It's great. But
I'm Dr. Anthony Rossi, and you're listening to Give Good Face. Today, I am most fortunate to be with Michael Crumm, a master aesthetician in New York City. He's also the co-host of a podcast, Beauty Curious, that you can check out, as well as the 2025 MRF, that's the Melanoma Research Foundation, Get Naked campaign. So he has a lot going on, and he's going to spend time with us and talk about everything from skin tips to finding skin cancer and everything in between.
Totally. I'm so excited to be here. Thanks for having me.
Yeah, thanks, Ian. So we've known each other, for a little bit now, and we see each other at all the same events. And I'm really curious to see how your career has progressed and where you came from, how you've evolved. And, I know you have a passion for skin. So how did you translate that into a career?
Totally. So I've been into beauty since I was little. My mother is very cool. She's had like these long design nails. She always gets these custom nails all the time. She's
getting
like
a good picture right now.
She goes, gets her hair dyed. And so when I was little, I had an affinity for her doing her nails and hair. And she started taking me to the salon. She'd let me experiment with getting my hair colored, or I'd get like pedicures while she's getting her nails done. So I was always into beauty as like overall. And in high school, I had mild acne, nothing crazy, but I had some mild acne.
Sure.
And I had these bumps around my eye that at the time I had no clue what it was. I went to the dermatologist, realized it was milia.
We've all been there.
Got those out, and they sent me to the aesthetics wing of the practice, had a low-grade chemical peel. And that was kind of the moment that started fueling more of my interest in skin. I had always been into all the beauty things, but when I was in high school and had mild acne, went through that process, I just kind of had this affinity. And at some point I subscribed to like Dermatology Times, and my mom was like, what did you order? Because I had a debit card, and I'm like,
You read the new beauty magazine, Dermatology Times.
Yeah. I was always buying New Beauty, which I didn't realize, I guess it had newly come out around that time when I was in high school, but I would always buy that, read that. And so in high school, I started taking like AP Calc, advanced science classes. I dabbled with the thought of going pre-med.
Oh, nice.
And in a conversation with my great aunt, my grandfather's sister, sort of just realized I don't think I want to be a doctor, but the idea was fun in the moment, and I was kind of preparing, and I've always liked math and science classes anyway. So didn't end up doing that. But in my brain, I thought, oh, maybe I'll go pre-med, become a plastic or a derm, because I was like that whole process with my derm at the time. Went to school for marketing communications, didn't take that path, but as I established, have always been into beauty. And when I went to school at the time, I actually thought I wanted to produce fashion shows for a living. So I got in this whole path of like volunteering for event planners and in the whole like fashion marketing world. I technically started blogging in high school, but I started my blog my freshman year of college, and I just kept doing that. So for many years, I was a lifestyle fashion blogger. I used to do stuff with like Details Magazine whenever it existed, RIP, GQ, Refinery 29, etc. And over the years, I would always still talk about beauty. So kind of kept going down that path. A lot of cool things started happening in the blog space. Obviously, over the years, Instagram grew and grew and grew. Just overall, like I started out on WordPress, so I used to just blog every day. And after so many years of blogging, I was like, this is fun, but I started getting tired of always being on my phone. I sort of hit this lull. I had shifted from doing mostly fashion content to talking a lot about beauty and was getting questions online about skincare. And I would post when I'd go get facials or any sort of other treatment. And I'd have a lot more dialogue around that. Fashion's great, but I was getting a lot of like, you look great, or I love your outfit, or cute shirt, that sort of stuff. And
Yeah.
I was like, okay, I'm not really feeling fulfilled here. So decided to do the aesthetics path. And that was really just for my personal kind of confidence in people asking questions. So I felt like I would always been well read, but I started to second guess like, oh, I hope I'm recommending the right product to these people that are asking these
Yep.
questions. But then through that process, I'm like, I really do like massaging. One of my top love language is touch. And I don't know, there's just something making someone feel really relaxed and beautiful in a treatment table. So I've kind of just honed in and focused on that the past like almost 5 years of, okay, I'm going to do facials aesthetics, but it's complemented now with all my digital past with, well, digital past and present in terms of content creation. And my platforms have now shifted from what used to be like fashion lifestyle blogger to beauty blogger, esthetician to now definitely like skin health advocate. And as you mentioned, I talk a lot about sun safety, skin cancer prevention, awareness. So yeah, that's the fast version of the story. There was a lot of things in between.
That was the fast version.
That was the fast version. There was a lot of pivots and crazy things that happened in the middle. But
that's real. That's great. Like, it's not always a linear track. So it's really cool how you came back to beauty, back to skin health, which was something you were super interested in when you were a kid.
yeah,
So word to all the moms, like really encourage what your kids are putting out there.
yeah, my mom definitely always encouraged it. I remember at one point, like I said, I've just beauty in general, not just skin, like always changing my hairstyle, playing with makeup. She bought me one of those like mannequin heads that cosmetology students use. And I would like play and put makeup on it. And so anything beauty related, I was always interested in some sense.
Cool. So I grew up with hairdressers. My parents were both hairdressers. They have a salon. So I always grew up in the salon. And I do remember my dad from a very early age making me go to the esthetician actually and get regular facials. Like you, I didn't really have bad acne or anything like that.
Yeah.
But he actually recognized the importance of seeing an esthetician and getting regular extractions, getting facial massage, lymphatic drainage. So my father actually was a big proponent of that, which I think is interesting, in that sense. It was super relaxing. Not that I needed to relax because I was basically in high school and like, the world is not that stressful. For me, it wasn't.
I think in high school, I had like 2 breakdowns in high school because I put too much on my plate and then you learn how to manage it as you get older.
But they were it was relaxing. It was also a source of information because the esthetician was like super knowledgeable about like what I was putting on my skin, making sure that I had a good diet in relation to my skin. So it was really a source of information. So tell us how you integrate your work with like what I do, dermatology. And I'm sure there's a super overlap and like you see patients all the time.
I mean, I feel like at times derms and estheticians butt heads, or at least on the internet.
Tell me, yeah, I know there's a lot of that. What's the beef? Yeah,
I think maybe just approach to how to treat the skin or whether they think certain modalities will work.
Okay,
cool. I feel like because I have always, I thought I might want to go and be a derm. Like I've always very much appreciated medicine, so I think there's areas in aesthetics that get more holistic in a sense and don't want to engage with anything sort of related to a pharmaceutical.
Gotcha.
I feel like everything I do is like a blend. I like Eastern practices, Western practices. It's I'm kind of like more is more of like anything to make me feel good, relax, monitor my health.
You partner with the derm.
I'm not here diagnosing disease. I'm not a medical.
Yeah.
I'm not a doctor. So I think derms are very necessary in my facials, in my intake form. Actually, I'm trying to think if I've ever seen this, but I ask people if they've had skin checks and the last time they've been to derms, and I make it a big part of, me talking about sun safety. I make it a big part of what I try to push on clients and remind them, okay, beyond even if you've been wearing sunscreen every day, if you haven't had a skin check, like I really need you to go see a derm. And I've
Yeah,
referred them or helped like link them in with my different dermatologist friends.
that's amazing.
So I think kind of started using this new tagline, beauty starts with your health. So,
I like that.
I think
You heard it here.
you have to, you have to, know what's going on and whatnot. So in terms of an esthetician myself or another esthetician working with derms, I think comboing what you guys can do in terms of advanced lasers, deeper peels, obviously just full on skin checks. And then, I mean, estheticians were the ones that are in there touching
Yeah.
the face for potentially a full hour.
Yeah.
And I feel like that's the big difference I try to explain to clients or just people on the internet is derms should be your first start. You should be getting like a full check, make sure everything's healthy, good. You can get guidance from them too. And then for your like monthly maintenance, like unless you're dealing with a very intense skin issue and you need to go on some sort of oral medication, go to your esthetician for your monthly maintenance and whatnot. But I definitely think derms and estheticians should be working hand in hand.
Yeah, same. I mean, I love my patients that go see estheticians on the regular because they're getting extractions. They're really maintaining like their skin health in the
Totally.
fact that they're becoming really conscious about what they put on their skin and how they protect the barrier. Also, the lymphatic drainage, I think, is super important
Totally.
just for overall puffiness and such. And, the engagement, I think, is helpful because if I put someone on isotretinoin or Accutane,
Mm.
they're becoming super dry. They have to really be mindful about sun exposure and also just keeping the barrier protected. So if they're seeing an esthetician every month, that's huge. That's awesome.
I
Yeah.
think too with skincare routines, well, being in this space, I test a good amount of products, but I
Sure.
would never recommend anyone test as much as I test,
Yeah.
and I try to get people stick to your routine.
Yeah.
It is a living organ. It's going to shift with the climate and just, a ton of factors, but you should be sticking with pretty much the same set of products for a good chunk of time and you can like rotate things in and out. But I think people that are able to go see their esthetician, they kind of get these like micro refinements on a
Yeah.
month to month basis. Like, oh, actually that product's not working. Like, let's like
Yeah.
swap it out, which are things that I
Yeah. It
don't
would
think
be
it
hard
really
for them.
doesn't, it
That's a great point, Ian, because they're seeing you like pretty monthly, right? Almost every month. How long do you ask them to actually try their skincare? Because I always tell patients, like, you need to give it at least 6 weeks to work, especially, and if they're using a prescription, right? Like, that's going to go through a phase, right? Like, I might give them isotretinoin and they may break out. Isotretinoin's Accutane. So they may actually have a flare and they need to like work through that
yeah.
flare. Yeah.
I normally say it's like 4 weeks minimum.
Yeah.
Because I like to go off of say like, hey, your skin cycle is 28 days, but it slows down as you age, that sort of spiel and just
Totally.
educate around how the skin actually
Yeah.
works. Like, and
That means like the skin cycling over and turning over.
yeah, and I try to remind them that a lot of claims from brands when they make like, oh, blah, blah, blah in 7 days, it's like you got to read through the marketing and
Yeah.
not be like, why doesn't my skin look like I got a facelift after, 2 weeks? And it's like, well, it's not going to.
Yeah.
So I say 4 weeks, but I like to also put guardrails there of obviously if you put a product on and it starts burning, like you have to be aware of signs if it's not meant to exfoliate your skin, like why is your skin turning red? So
Yeah.
don't just keep using a product because you're giving it the 4 weeks. You could have a reaction. So you got to be aware of those things. But yeah, I think 4 weeks is a good baseline, but I like 6 is better. I just find that people do get impatient. And also, you can't like keep swapping things in and out.
Mm-hmm.
If you want to see like if your skin improves, you can swap one product,
Yeah.
use that new product. It's hard when people want to start just like overhauling everything.
I know. That's my biggest concern is like people are impatient, right? Especially with their skin because it's so visible and like they really, they get an emotional reaction if like their skin's not having a great day.
Yeah.
And the idea of like skin cycling over and over and over again, they're never giving something a chance to really do its magic or do its work, So I do think they have to like cut through the BS marketing claims. So I tell people to look for clinical trials
Yeah.
or real clinical results, and then give it a good go for a while. Yeah.
I tell people often, I'm like, you'd probably be shocked at, and I've posted, my skincare routines before, but probably shocked at how minimal my routine normally is. Because I
Totally.
think people just assume, it's like 10 steps
Yeah.
or whatnot, but
You don't have time for 10
day to
steps.
day,
Yeah.
it's
Yeah.
pretty simple.
Exactly. Part of my step is my dog licks my whole face,
Ah,
and so
is that your pre-cleanse?
yeah, exactly.
You're
That's like
getting,
an enzymatic cleanse
I
in
love it.
itself. Yeah. He loves when I come home from the gym and I'm sweaty. And so that's like,
You're getting a little
that's one
micro
step of the 12.
exfoliation
Yeah.
there with his tongue.
So what do you find a skincare ingredient overhyped right now? I know this could be
Oh my
controversial, but
gosh.
what's an overhyped ingredient that you see people gravitating towards?
I like hyaluronic acid, but I do think that it's just in everything. And there's a lot of people that feel like they need a dedicated serum
Mm-hmm.
when, like, in their routine, which it's fine, but
Yeah.
I don't think that's going to change your face. I think if you're going to an event and you want to layer on the hyaluronic or, hydration and really plump up the skin, but I'm more concerned with someone getting that sunscreen on their face and using an antioxidant. Find like people are using hyaluronic acid, moisturizer, sometimes sunscreen, and like they don't have an antioxidant in there. So I'm
Yeah.
like, market this a little less and market getting
Totally.
things that are actually kind of doing a
For
bit
your
more.
skin health.
Yeah.
And
But there's a lot of overhyped ingredients.
yeah, there's a lot of
I do like hyaluronic acid.
Yeah,
though.
of
I'm
course.
just saying, I think
It's
the general
yeah.
perception is it also is going to like potentially transform someone's
Yeah.
face and it's going to hydrate it.
Yeah, for sure. It's a great hydrator. But yeah, I see what you mean. And
What about you?
yeah, I
I'm so
honestly,
curious.
I think people know this already because I always say this I think vitamin C is way overhyped. I love antioxidants. I just think there's so many good
It doesn't have to be
antioxidants.
vitamin
Yeah.
C. It can be any
Yeah.
antioxidant.
I'm a huge proponent of antioxidants. The vitamin C story has evolved over time. And I think so many brands have just like automatically included because they feel like they have to.
Yeah.
And there's so much market awareness about it. Does it actually help? I've seen a lot of people get irritated, like you said, and they just will keep pushing through with it. And I'm like, no, stop. It's a weak acid. It's actually irritating your skin. But
I think
that's my hot take.
ingredients just go in cycles because of marketing.
Totally,
Hyaluronic acid, vitamin C, niacinamide has like had a really big market share the last few years.
I slather niacinamide. I take nicotinamide. I'm all about like the internal exo. So yeah, I do love an antioxidant though. Yeah. I also work at a cancer center. So I tell people, if they're on chemotherapies and such, like you have to be very careful with ingesting antioxidants because like, it actually works against the chemo, right? Whenever you're seeing an esthetician or, a derm or anyone, you really have to tell them what you're going through. So like that intake form is actually important. So people fill out the intake form.
A lot of people breeze through it.
I know.
I don't like really give the details here.
Totally.
And you asked what their routine is and they're like, cleanser, moisturizer, SPF. I'm like, I want to know what
details.
Like get granular. Yeah.
And you brought up a good point, like prepping for an event. So many people will be like, I'm getting married next week. What can I do? And I'm like, absolutely nothing. Like you're perfect, for this next week.
Yeah.
What is your go-to, like, let's say you're prepping because it's going to be fall soon. You're prepping for a wedding. Right?
Sure.
When do you want people to come in and start? What do you like to do? Walk us through that.
I mean, I would definitely tell them to go to a derm like 6 months before and see if their derm's wanting them to do any sort of lasers, more advanced treatment because you have the time there. Maybe like 2 months before, I do like a low grade peel, another month before like a low grade peel. I do like very, very gentle peels that someone might flake a little bit. It's more just for the glow and a little extra exfoliation. But I will do that. And then, yeah, it's just hydration and a lot of lymphatic. I know there's estheticians that have other specialties, but I always say it's all about my fingers.
Yeah.
So it's
a great tagline.
As I mentioned earlier, I didn't actually think that I was going to even really practice aesthetics at all, but I liked the facial massage element through the training. And I like being able to offer that to someone. And the other day, actually, I was doing a set of editor facials and one of them asked me, don't your fingers get tired? And I'm like, it's actually the opposite because I've had so many years where I'm like gripping my cell phone,
Yeah, yeah.
and like always on a cell phone, that it's this break from that. And I say a facial massage is like ballet for my fingers. So they're
Oh,
like
nice.
flailing, like flipping and flailing all around. And it's like just pretty much stretching my hands out. So a lot of lymphatic massage. I like when people go get full body lymphatic massages. I'm all about multiple specialists getting in there, especially if you have a big day for a wedding, go see
Yeah.
your derm, go get lymphatic, go to the sauna,
Hmm.
sweat it out, get,
Are you a fan
multiple
of red
facial.
light or blue light? Like,
I
give me
am.
the hot take on that.
Yeah, I
Yeah.
I love
I mean, I
LED.
sit in front of a red light panel, so
Yeah, LED is great.
yeah.
I use LED in basically every facial at some point
Nice.
throughout the process. Little EMS, my fingers. I like using cryo globes, cryo wands as well. I like to balance, obviously, doing drainage, stimulating the muscle with just a sensorial experience. It's this hybrid of like, let's get you results, but also let's have you relaxed. I like doing people's facials before they have a big event. And sometimes that's like the morning before they might go into hair and makeup, before they have like a carpet or
Hmm.
whatnot. And I like to explain, this is kind of a moment for the person to really just have their own moment and relax and get in the right headspace, because getting your hair and makeup done isn't normally like a relaxing experience. It can be really fun, but
Yeah.
it's high energy. And then if you're going straight into a carpet or a performance or something that's, very stimulating, like it's nice to have this moment where you can kind of like dump all of your anxieties or just sort of pent up feelings. So I
Yeah.
like my facials to be just like obviously get results, but super relaxing at the
Yeah.
same time.
And if someone hasn't had a facial, I think they should experience it, but they want a good one. The actual lymphatic massage and the finger massages and the drainage, it makes you feel good. Like you come out with this glow because there's increased blood circulation to the face.
Yeah.
You're using great products, obviously, but also that lymphatic drainage, I think, is really important.
Also, just getting certain tensions out of the face.
Yeah,
I've worked with a singer, and she had crazy like TMJ. Like,
totally. Yeah.
I mean, I have tight masseter, but I was like, wow, like it was like a rock.
Sure.
And we did like 3 facials 3 days in a row, and I really focused on her masseter tension and just, I mean, all facial tension, but like her masseter, and she kept getting like lockjaw, and she's having issues singing. And she swore like after that little trio session that it was just like
That's amazing.
her, you know, singing was not her actual voice, but just like how it feels to sing was improved, because
Okay.
she was having
Yeah.
issues and like just so
Yeah.
much tension. So just helping address with those things is really good too.
Give me your take on Gua Sha. Should people be doing it at home? 'Cause
Yeah. I mean,
I
there's a
was
lot.
just in Korea and it's all, it's everywhere.
Yeah, I think gua sha is great. Like I have different gua sha style tools that I'll
Yeah.
use sometimes in facials as, added massage. So, I mean, a lot of it is my fingers, but there's a lot of great videos, tutorials online, and there's also a lot of skinfluencers or people that,
New face.
acting like they're a doctor or a licensed
Yeah,
skin
yeah.
professional, and they're like going like up and down, and
Yeah,
there's
yeah.
no actual
Can you
reason
show
for
us a
their
little bit of like,
reason to their
yeah,
method.
yeah.
So
Can you
you're
just
like
show our audience like what direction you should be like
upward
draining?
and
Yeah.
outward. I
Yeah.
mean, you have a lot of lymph nodes here.
Yeah, for sure.
So you want to definitely start like under, maybe I'll look this way. Like
Yeah.
you definitely want to start here. Actually was doing this with another doctor the other day, and it's kind of hard when you don't have any product on your face. So put a little serum there,
Yeah.
but basically just glide down along. You want to go up. It's kind of like right behind your ear a little bit. Sometimes they do a little pulsing here, and then sweep down the side.
Nice. So you're really working with the lymphatic chain here and then draining patterns of the lymph nodes. Like
Yeah,
our lymph nodes drain in a specific pattern. And I think it's actually sometimes hard to do it yourself. And that's why I think like
it is.
going to see
Yeah.
an esthetician who's really specialized in this is a game changer. It feels different. Yeah.
Yeah, so definitely like working all the lymph passages, and then I like to do a lot around the eye area
Yeah.
and kind of like helping like lift it out and
Nice.
releasing tension here. So Yeah,
Amazing.
and then sometimes you gotta like put the gloves on and do intraoral and get
I'm
in there
glad you
and
use
really.
gloves.
Well, I mean,
Yeah.
yeah,
Yeah.
but when you do that, I feel like you can, if someone's having masseter issues too, you can really kind of get in and just
Yeah.
work the muscles in a different way. And I think intraoral massage feels amazing. Some people are really weirded out by it, but it can help relieve a
Sounds
lot of
relaxing.
tension.
Yeah.
Have you ever had it?
Not
I brought my gloves,
you
so if you're
really? Okay.
ready.
Thank you. I was like, have I ever had it? I was like, not at an esthetician's office. No. But yeah, I mean, I think it's really important, like because even myself, like when I'm examining someone and I'm feeling their masseters, like I want to feel inside, outside, you know, there's a whole anatomy that's complex there, right? And,
Yeah.
again, the anatomy. It's really important to understand that you have to go to someone that eats, lives, breathes, sleeps this craft, because it really is something that's really important. And you can get so many different degrees. Just like a doctor, you can get different degrees of a doctor, you can get different degrees of an esthetician, right?
Yep.
Someone who's just
And
about the product or someone who's really about the holistic approach.
yeah, and there's
Yeah.
other trainings. You get
Yeah.
certified with different peels or massage
Yeah.
techniques, and yeah, that's the fun thing is
Yeah.
you can just keep going and learning.
Do you feel that, and I'm leading up to another question, which I think you'll like, but the idea of facial shaping. Can you help shape someone's face with lymphatic massage and, this tension that we put in?
Yeah, I think if someone drank a lot, had a lot of
Yeah.
salt, they're holding a lot of like lymph fluid in their face, you can see it pretty much instantly after you start working on it for a
Nice.
few minutes and let it start to slowly drain out of the face. And I like to talk about, any sort of muscle stimulation. It's like going to the gym.
Can I ask you this? Have you been to a face gym or?
I have been to a face
Yeah,
gym.
I went once. It was interesting.
Did you like it?
Yeah, they used a lot of like electric current to like
Yeah.
stimulate it. Yeah.
Yeah, I like electric current, EMS, like obviously like hand motion. So I think you can definitely get a sculpt from a facial.
Yeah.
Absolutely.
Yeah.
But it's just like working out, if you work out for a couple months and then you stop working out and you never work out another day in your life, well, you're not going to keep your results. It's I think
Totally.
it's the same thing with any sort of lymphatic drainage, muscle stimulation on the face. It's the same as working out. It's the
Yeah.
same as you're not going to have hydrated skin if you put moisturizer on once and then you stop using it.
Amen.
Everything is a daily practice. So, I mean, I've other esthetician friends. I've had some amazing facials from friends of mine where I leave and I'm like, wow, I feel
That's cool.
just,
Yeah.
like they really lifted and
Yeah.
got rid of tension. And again, I think you said earlier, it's hard to do on yourself. Like I can do so much on my face, but I also love going to my other esthetician friends and being like, please treat me like massage
I
and
think I
get
think it's
sculpted.
important for us to like seek out other professionals, right? Because like I see so many, people do their own Botox on their face, and like sometimes you need like, that other set of expertise and eyes to really like hone in on like what's good, right? And especially,
I want to know, like, there's a lot of hairstylists that cut their own hair, and I'm like, how are you doing
I
that?
know
Because I've
it's
tried to
hard.
even just give myself a blowout when my hair is longer, and I'm like, I'm done with
Yeah.
this. I cannot.
It's funny when I see my parents cut each other's hair because they're so perfectionist. They're always like bickering about it too. It's like
Yeah, like you did
kind of
this wrong, or
hilarious.
do
Yeah,
this, do
yeah.
that.
What do you think of Kim K's new, basically like, liposuction garment for your face? Like it just came out. So
Yeah,
have you
well,
tried it yet or no? It's basically a liposuction garment for your face, but she's slinging it as
like a face shaper.
a face shape.
I mean, it's compression, obviously. If
Yeah,
you've had surgery, it's great,
it's great. Yeah.
but you need motion for lymphatic drainage.
Good.
So
Good call out. Good call.
I don't. It's just gonna. I don't want to sleep in that.
Yeah.
Do you want to sleep in that? That
I
seems
mean,
like I haven't tried it on, but
I don't know how tight it is. If it's as tight as a liposuction garment, that's tight,
yeah, I don't think it's that tight.
Yeah, we'll find out. Yeah.
Yeah. I mean, maybe we should order one. I think it's
I
sold
heard they're
out,
sold
but
out. Yeah.
okay.
But people want these things. I don't know if it's her cachet that people are buying them, or they really want to believe that it's going to shape their face. But
I think the thing too with okay, let's talk about face shape.
Yeah.
Like a lot of times people will pinch under here and be like, can we like snatch this up? Sometimes people have lymph fluid built here. Sometimes they have a lot of puffiness. And if you do a proper lymphatic massage, great facial, like, yeah, they might look pretty different by the time you're done there. Some people also have a fat pad here that's a little extra, and they would be improved from getting chin liposuction.
Yeah.
And some people have more just skin laxity. It's not even, like they have much fat, but if you're getting laxity and then you're getting there. So I think it's also addressing what is the cause if you want a snatched jawline, and if people think that compression garment is going to give it to them. It's like, well, one, you need motion for lymphatic. So it's not going to help you like move your lymph fluid out. Obviously, compression's not bad, but it's not the same as getting a lymphatic massage. If you have skin laxity, it's going to do nothing.
Yeah. Yeah.
And if you have a fat pad there, it's going to do nothing.
You're breaking hearts right now.
Yeah. I mean, you just have to get to the bottom of, you also know like what might be causing or if someone's wanting that snatched jaw, like there's multiple things there to achieve it.
Totally. There was actually a good study by Dr. Alam at Northwestern. He actually studied the facial exercises to see if they actually made a difference in facial shape.
Mm-hmm.
And they did show a positive correlation between facial exercises and like mid-face fullness. So like it actually did help change their face a little.
It's like lifting.
Yeah. So, I mean, again, but it only works as you keep it up, right? So keep going with, the gym and everything else.
Totally.
Shifting gears just a little bit. How did you get involved with the Melanoma Research Foundation? Because that's huge. We work with them a lot, from the skin cancer point of view.
Yeah. So I mentioned earlier how I thought I might want to go pre-med to be a derma or plastic. Didn't decide to do that. So I've always had this affinity towards skin health. My grandmother's a melanoma survivor. So
oh, wow. I didn't know that.
When I was young at her pool, she has a scar on her from her right knee into her inner thigh, like a quite large scar from her surgery. She had it back in the 80s. So I was aware of skin cancer and melanoma from a young age because of her telling me at the pool, and, started wearing sunscreen. I mean, I had my moments over the years where I got a burn or wasn't super, super diligent.
Did you ever use tanning beds?
Honest
answers only.
I know I was in one like a handful of times.
Same. I mean, I grew up in Staten Island.
Yeah. So that is like my skin sin that I
know.
Just like,
wow. I wish I could reverse that.
But only a handful of times. So it's not like I was like tanorexic or anything.
Yeah.
And so
that's the technical term.
I was always into protecting my skin from a young age, for the most part, minus my mess up with a few tanning bed visits. And I've also always been interested in just clubs, extracurriculars. In high school, I was in like the Green Club and Best Buddies and Student Council, National Art Honor Society.
Overachiever.
So when I went to college, the same thing started happening. I was in different student orgs, the LGBT club. I was like writing articles for the newspaper. I just like the extras.
Doing the most.
I like doing the most. And in college, then through that process, I started doing some volunteering. I was on the Wistar Institute's Young Ambassadors, which is a biomedical research facility in Philadelphia on Penn's campus, not associated with Penn, but it's located on Penn's campus. I went to Drexel University in Philadelphia and got involved with the Philadelphia Art Museum and just different causes. So after becoming an esthetician and now living in New York, I hadn't done any of that in a few years and felt like I had my kind of wheels in a good position in terms of doing facials and keeping up with my content. And it's like, I want to get involved and kind of have more of a deeper meaning. I had been talking a lot about sun safety and using sunscreen on my channels. So my aunt actually, this is the step before getting involved with the MRF. My aunt got us tickets to the Skin Cancer Foundation Gala.
Oh, nice.
Probably 4 or so years ago.
Okay.
And got connected. If I want something, I'm not afraid to ask. So I basically asked them, because I was seated with one of the people from the foundation, how do I get involved? Went to lunch with them. By the end of the lunch meeting, I was on the committee for the Skin Cancer Foundation and did that for 2 years. And then I had been attending the Melanoma Research Foundation gala as well. I think it had been like 2 years that I went, and with Alta MD. And since I had experience in being on the Skin Cancer Foundation committee, I asked the MRF to join their committee. I joined their committee, and then that relationship just kind of blossomed quite quickly. I really liked the team there. They're just,
Really quickly, you got undressed for the MRF.
so yeah, I joined the committee and started, working on the committee. And shortly after that, they actually approached me about giving me their influencer award.
Nice.
So the gala,
Congrats.
and I was like, thank you. I was like, is that okay? Because I'm on the committee, but now you want to give me an award? And they were like, it happens. Like, so did that. It was the most I've ever raised for any of my charity initiatives for that gala, that particular gala. So that was rewarding, and I was very excited about that. And then that kind of morphed into, they do the annual Get Naked campaign, but if anyone watching, it's their annual public PSA for melanoma to remind people to go to their dermatologist, get their annual skin exams. So it's a bit cheeky. It's literally a naked photo shoot, black and white. You're not showing.
Very artistic, though.
Yeah, it's it's not like they're showing anything, because that'd be pornographic. It's artistic. It's meant to be a bit shocking and be like, oh, get naked, what? And catch people's attention. So yeah, they approached me about being the spokesperson this year. So I'm their spokesperson for a year for the Get Naked campaign. And
that's amazing.
We've had a lot of fun initiatives. I've officially found out last fall. So it did consume my team. I have different management and for my content projects. And once we found out, I was like, we're really going to do this. So on top of what the foundation plans, we started planning additional initiatives just to make it a larger public awareness push, from shopping fundraisers to a media tour to just hosting other events. So it was a really fun time.
I love that. Yeah. I mean, we got to destigmatize getting naked in front of your doctor, at least.
Through this process, have realized how prohibitive it can be, because I don't know, I guess I just was comfortable getting naked, but there's a lot of people who feel shameful, or I think in health care overall, there's a lot of people that might want to avoid going to the doctor.
For sure.
Ignorance is bliss sometimes.
Medical distrust. Yeah.
So it's really more just, my friend, Dr. Garia, he has 2 practices in Jersey, and we did a skin exam event that we wrapped with the MRF, because he's on the committee for the gala this year. And we had creators come, and I did like a sun safety presentation to them, and he gave them skin exams. And then they made, Instagram Reels, TikTok videos about them going and getting their skin exam. And the whole point of that was really showing it's super easy. Once you get over, oh, I might feel uncomfortable because you're actually getting nude, it doesn't take that long, getting the glance over, checking the spots. It doesn't hurt, unless maybe you need a biopsy, but that's
also minimal pain. Yeah. I think destigmatizing the whole process is super important, right? I mean, we try to tell people, it is, especially if you have a family history, like it's super important to get checked. So that's amazing. And the MRF has, awarded our fellows at the hospital grants for their research in melanoma, which has been really wonderful. So it's a great organization. So congrats. Yeah.
Thank you.
Yeah.
They're really
cool.
fun to work with.
Yeah.
And I'm also part of the Get Naked. They asked me to be the gala co-chair. So I'm co-chairing their gala, the New York gala, October 30th this year.
Oh, cool.
So if anyone's listening and wants to attend, let us know. Amazing. It's at the Cipriani and Financial District.
Fun. Speaking about products and, the time it takes for things to actually work, some things get worse before they get better. How do you encourage your patients or clients to push through? What do you see? Yeah.
A lot of people, they have if they're trying to do retinoids, it's a disaster.
Yeah, because they have that purge.
The purge. There's also people that get confused with retinoids and prescription tret, and then they buy a product that's...
I know. I don't get it. If you're using prescription retinoids, people, you don't need retinol in your products.
Yeah, but there's a lot of confusion there, and people that want to use both.
And they're marketed. Retinol is so heavily marketed that they don't understand that if you're getting a prescription retinoid, you're good.
Sometimes You mentioned you don't love vitamin C, sometimes certain antioxidants, but mostly vitamin C. You get a little sting if it's,
Yeah.
you're a little sensitivity to it or it's a high concentration, maybe not necessarily awful. I normally have them use a lower grade if
Hmm.
they're getting stinging. I think it's really mostly retinoids.
And then how do you determine what type of facial someone needs? Like, tell us, what you think
So I
or what type of
mostly
facial you
only
do.
do like pre-event. That's my whole that's what I love. It's like I
Okay.
love the massage element
You love the glam.
and I love referring to friends. So, if someone is having, they're concerned with acne and really want more of like an extraction heavy facial. My friend Sophie Pavitt has Sophie Pavitt Studio in New York,
Oh, yeah.
and I'm telling people all the time, like, go to her studio. That she loves, they really focus on acne. There's a ton of different facials. I mean, I think pre-event, anything just like hydration, focusing on massage, some soothing masks, maybe some oxygen. That's all great. Like, no downtime, and then
Increasing circulation.
increasing circulation. If someone's going to the esthetician because they're battling acne or they want to really lift pigmentation, maybe they need a peel, you're going to get some downtime there,
Yeah.
especially depending the grade of the peel. Oh, other types of facials. I mean, lots of things you can do on a facial. Some people, I think, when I do a facial, I try to combine obviously my fingers and LED, some cryo. There's sometimes people go and they get like a piece of that. Like they just get a facial. Some people would just offer or they'll do facials that are like 100% massage the entire time
Yeah.
or kind of just like an overall hydration facial. There's a little bit of massage, but it's more just kind of working through like an enhanced skincare routine.
Hmm.
I like people to look for massage heavy facials. I think oxygen's great.
Some of my patients ask me, can I get Botox and then get a facial? Not like on the same day. Like, give your Botox time to set up, which is usually very quick, like 30 minutes or so. Like, it actually hits the receptor, but don't immediately then go get like a massage heavy facial or anything like that. Yeah.
Yeah, I feel like this is where derms have butt heads because I've
Oh,
asked so many derms like their
yeah.
protocol, and some people have said, "Oh, they can get one 4 hours after." Some
Yeah.
people say, "Oh, at 30
There's a
minutes and
lot
it's
of,
in," and then
there's a lot of like old wives' tales.
yeah. So my facial is super heavy, so I like there to be like a 2-day period in
Oh, nice.
there.
Okay. So
Like
you're
I'm
even
like
more conservative. Yeah.
cautious.
Nice.
But I've asked so many derms, so I'm
Yeah.
happy to hear your take on it as
Yeah.
well. A lot of intake forms at spas will ask for a 2-week period.
Yeah, which is interesting. I think that's 2 weeks is the time that it usually takes to like fully kick in.
Yeah.
But I'm just more cautious about like the pressure on the skin, like right after the injections. And most people are not like running from this office to that office. But
Yeah, I feel like most of them for neuromodulator ask 2 weeks and
yeah,
for filler 4.
yeah, which I think is like overly cautious, but
How long would you say for filler? If
yeah, it depends what you're doing. Again, I wouldn't do it right after. I would give it like a good 48 hours to like set up. I mean, there are certain fillers that don't really integrate for a full like 2 weeks
Yeah.
into the dermis, into the fat. So, but for the first 48 hours, you can sort of mold that filler if you're pressing really hard. And I tell patients that like I said it, they forget it, meaning like I'm putting it strategically where I think it needs to be and what they want. They're not going to go home and massage the hell out of it because they run the risk of deforming it a little bit, especially in that early 48 hours.
Mm-hmm. But some of the fillers you're supposed to massage.
Yes. And unless it's like a more skin booster, skin hydrator, you need to massage that. I say go to town. Sculptra, polyl lactic acid, they have to massage 555. We say 5 minutes a day, 5 times a day for 5 days.
So
So go for that facial.
if you give someone Sculptra, when would you allow them to see me?
I don't mind them to. You can go right after, because they need the massage anyway. They need to massage that. Sculptra, is made out of suture material, so they really need to help break that down and make sure they don't get any clumps or bumps. So we can work together. Yeah,
Love it.
yeah, that's great. So Ian, this was an amazing conversation. I learned a lot about you. Actually, I didn't know your whole history, so that's awesome.
Thank you for having
And
me.
yeah, thank you for being here. I gave you all my skincare. So in true OnlyFans fashion, you can rate my skincare later on.
Okay.
Yeah.
I love it. I'll be back, guys. We're going to do the rating.
Yeah.
Maybe I should grab it now and do like a first reaction.
Yeah, exactly.
But that's contrary to what we said. You need 4 weeks at least.
You need
6.
to give it time. So that's a great message that we could just leave the audience. It's like, there's a lot of marketing out there. You really need to give things time to work. Give it a critical eye and try to, brands push out SKUs all the time and that's trying to keep things fresh. But there's certain things that really do work and you need to find those products or partner with derms and estheticians.
I'm always testing being in the space. I'm going to test. I've already tried a few products. I'm going to make sure I test all of them. But I also end up gravitating after I've tested things and can be able to like have the product knowledge of, whether I'm going to vouch for that product or not. I always end up going back to certain products that are my like holy grails. So
yeah, I mean, you're always giving good face. So
thank you. Once you find those products, unless you work in beauty, like stick to your products until you feel like you need to get a little boost, and then start by asking your derm and your esthetician like where to boost it.
I love it. Thanks so much for listening. Don't miss an episode. Subscribe to Give Good Face wherever you get your podcasts.